Hi everyone, I wanted to do a video on trigger finger, and that's when you get a locking along most commonly your fourth, the third, or the second finger. Sometimes it can occur on the thumb. The factors of getting that triggering of the finger is that you could have if you have osteoarthritis, if you have diabetes, if you're a woman over the age of 40, a lot of those things make you higher risk for getting that trigger finger and that locking. So the reason that happens is sometimes there's scarring along the tendon lines and there's a pulley system in our hands. So when it catches, it's hard for it to release, to open again. And a lot of times we have to manually do that. And when that happens frequently in a day, it can be quite painful and bothersome if your finger's catching, and we want to try to stop that. So many times you could try conservative things first. If you're having something like that happening, you could try wearing a wrist splint at bedtime, which will kind of hold your hand straight so it's not bending over when you're sleeping. That can be very helpful, so I usually recommend that for at least 4 weeks to see if that helps. Other things that can be really helpful is trying an ice pack. So, put an ice pack over the area and the finger over that tendon that's bothersome, the one that's locking. Put it there, wrap it, wait till the ice melts. So usually about 10-15 minutes. Try that about 3 times a day and see if that helps. If still it's persisting after trying these things for about 2 to 4 weeks, then I would say sometimes an injection can be helpful, and that's usually a steroid injection locally into that area that it's catching along, where there's scarred tissue and there's that catching along the tendon due to the scar tissue itself. Many times, just by doing an injection, we can get rid of the problem. So you wouldn't need to have a surgery or anything like that. But if it keeps recurring despite these conservative therapies, then sometimes orthopedic surgery will do a release surgery um, in order to kind of clean out that scarring along the tendon. So I hope you found this helpful. If you have any questions, comment below. If you have any other video ideas, let me know.